all of us in many ways. And I think that hopefully at the end of this lecture, we'll have some understanding of the importance of learning how to help ourselves reduce our stress and create some relaxation. I would like to introduce Laura Redwine, the director of our research program, who will introduce Anisha.
Thank you, Dr. Schwartz. It is my pleasure to introduce Anisha Durve, who is Doctor of Acupuncture and Ayurvedic doctor, who joined the University of Miami's Osher Center for Integrative Health in February of 2022. Dr. Durve has been in practice for 24 years and received her master's in acupuncture from the Southwest College of Acupuncture in New Mexico. And she interned at the Academy of Traditional Chinese Medicine in Beijing. Dr. Durve co-authored a clinical textbook on acupressure with Dr. Ladd entitled Marma Points of Ayurveda. She's also a yoga therapist and a meditation instructor. Her mission is to integrate the Eastern healing wisdom of acupuncture, Ayurveda, and yoga into modern Western healthcare through clinical services and community education to promote optimal well-being. So without further ado, I introduce you to Dr. Anisha Durve.
Hello, everybody. Thank you so much for joining us today for this talk. I know we have folks here in person with us on our campus, and I know we have folks on Zoom from lots of different areas. So I appreciate you taking the time to come and join us. Dr. Redwine mentioned a little bit about my background, but I've been in the acupuncture field for quite some time and have been able to really see this medicine flourish in many different settings. I've worked in hospitals, integrative medicine departments, wellness centers, detox clinics, spas, you name it. And so I've really loved seeing the versatility of this medicine in so many different settings. So a little outline of what I'd like to speak to you about today. We'll be talking about the relaxation response, my style of acupuncture that's really based on this understanding of the relaxation response. In traditional Chinese medicine, we have 3 levels of medicine, which I'm going to share about. And then we'll get to really understanding the mechanism of acupuncture from an Eastern and a Western perspective. And that'll give us some context to look at specifically the influence of acupuncture on brainwaves, and I'll be sharing some recent research on this topic with you. So let's start with the relaxation response. This is a term I'm sure many of you have heard of. It is really that state of deep rest that we're trying to cultivate, which is counteracting that fight or flight response, which we are all familiar with. For our ancient ancestors, this fight or flight response was triggered being in the jungle and being chased down by a tiger. In modern day, we experience this when the printer doesn't work or, something like that is happening. So this was first coined in the 1970s by Dr. Herbert Benson, and he really did a lot of research on this topic and showed how we can document the relaxation response lowers our heart rate, lowers our blood pressure, lowers our stress hormones, reduces pain, lots of different benefits that we can see from this. And so the reason I kind of start my talk on acupuncture today with this is I really do believe that relaxation is the first step for all healing. If we can't get to that place of relaxation, the physical body is not really willing to let go of its symptoms. The mind is not really willing to let go either. And when we can get to that relaxed state, we're kind of giving the body and the mind permission to be able to let go of chronic pain, chronic trauma, whatever it is that we're have been holding on to. So there's many modalities that can elicit this relaxation response. The most research has been done on meditation and mindfulness, specifically with the relaxation response, but we can also elicit this from yoga, Tai Chi, biofeedback, and acupuncture, of course. So my style of acupuncture does not look like Ed's 1-second acupuncture treatment you see there in the corner with the porcupine. I always like a little bit of acupuncture cartoon humor. But to put some context, acupuncture is a science that's 3,000 years old, and it has evolved into many different styles and techniques. We have forms of Japanese acupuncture, auricular acupuncture, hand acupuncture, Korean acupuncture. So there's many different styles that have evolved all throughout Asia, and now globally, and in the US specifically. This is a relatively new medicine that's only been here since the 1970s in this country. So my style of acupuncture, I like to call it Ayurvedic acupuncture, kind of blending my Eastern medicine training. And so I'm looking to see how to balance the 3 doshas of Vata, Pitta, and Kapha, which is based on pulse diagnosis. And I also like to add many other elements into this acupuncture experience. So I kind of call acupuncture my gateway modality. Once the needles are inserted, then adding on these other different layers of healing are all designed to continue with this relaxation response. And so I use Ayurvedic aromatherapy, Ayurvedic acupressure or marma therapy, guided meditation and visualization, breath work, chronic energy healing, sound healing with tuning forks. I like to call it spiritual coaching for lack of a better term. But during this experience, lots of emotions come to the surface, memories come to the surface, traumas come to the surface. And for patients to be able to talk about that while that is happening can be really healing and therapeutic as well. I also like to use affirmations. I believe this is a really powerful way to start to train our mind against some of the negative thinking patterns or thought patterns that we get stuck in, and reading some inspirational poetry just to kind of set the mood for some type of spiritual insight to kind of guide a patient's journey during this time. So the actual time of needle retention is about 30 minutes for the treatment. And then these other modalities are just kind of added in intuitively based on what I feel the client needs at that time, and whatever combination I think is going to best help them. So I want to share a little bit just about my calling of why I felt drawn to acupuncture. And I know this is a little unconventional to talk about your calling in a Grand Rounds presentation, but it fits in, if you bear with me, to what I want to share in a little bit. So I had a professor in college, a death and dying professor. And so I share a quote from her here where she said, "Reading a good book is like acupuncture. It touches you in exactly the right spot. It radically shifts your whole perspective, and you are forever changed." And that really spoke to me. At the time, I really didn't know about anything about acupuncture, but I was an avid reader. I knew that feeling, like I'm sure many of you here today, where you've read a good book, you've watched a great movie, and it does forever touch you and change you and your life perspective. And so as I became intrigued about this, I decided in college to design a 1-year self-study on integrative medicine. This is before it was actually called integrative medicine in the mid-90s, and was really called alternative medicine at the time. And so I designed a study to look at 5 modalities. Acupuncture was one of them. I went and met these practitioners, spent time in the clinic shadowing them, interviewed their patients, did some research on the modalities, wrote up a paper on each one. And also part of that study was to actually experience these different techniques. And so for my first acupuncture treatment, I was honestly kind of dreading it because I was not a fan of needles, which everyone thinks is a strange thing for an acupuncturist to say. But it was part of the study I designed. So I'm like, okay, I've got to do this. And I was around 21 when I had my first acupuncture treatment. And I really had a profound experience, which I can only describe as kind of the merging of science and mysticism. And so it was a lovely, beautiful experience. And what I felt is I was able to really experience the relaxation response at a level I had never, ever experienced it before. So I really felt radically that something had shifted physically, mentally, on many different levels. And so I was able to really have a feeling of experiencing the energy flow through my entire body and feeling like something had really opened up, something had shifted. I also had just a beautiful vision where I felt like I could actually see my body's intelligence, and I could see the energy flowing through channels bathed in this beautiful blue light. And it just really took my breath away. And I felt like in that moment, I was forever changed. And I really felt this is my calling, this is my destiny, this is the type of medicine I'm going to practice. And I also felt like this is the experience I wanted to give my patients. I wanted every person to be able to be in touch with themselves, to feel their true inner beauty, to be able to see that, to be able to glimpse that. And so that's kind of what started me on my path. The other thing that really spoke to me is as I shadowed this acupuncturist, I was able to spend a lot of time in her clinic, and I was fascinated that patients would come in for an hour and they would walk in looking one way and they would leave in an hour looking totally transformed, glowing, floating, visibly, their skin complexion had changed. And I was just like, whatever this is, I love this idea of being able to create change so quickly. So many of us here who might be in the healing profession know that chronic illnesses, it takes time to develop those chronic illnesses and that symptomatology, but it also takes a lot of time to restore the body and to heal that. And so this idea that in just 1 hour, a patient could experience a relief of pain, a relief of symptoms. But I also saw what I was witnessing on another level is everyone kind of left with a different sense of hope and a shift in their idea of it is possible to heal. And that really, really spoke to me. So right after college, I went and did my 3-year master's level training in acupuncture in New Mexico. Right after that graduation, I went to Beijing for a summer and interned at different hospitals. And it was really important for me to see the context of this medicine and this ancient modality and to understand how it was practiced in its native land. A lot of times when we import things into America, we have a way of Americanizing it. And so I really wanted to see how is it practiced there. I wanted to get a sense, is my level of training and what I have studied so far equivalent to the level of training of an acupuncturist in China. And so what really struck me there in my time working with the Chinese patient population is there wasn't really the placebo effect. There was no one doubting that this medicine wouldn't work. I didn't have to really explain it. This is something that was just familiar to everyone because it was mainstream medicine. And so I found that I actually got results with patients faster. So here in America, if someone comes with a migraine, let's say, as an example, maybe I need to see them for 10 treatments to really get significant results. And what I found in China is I needed maybe 4 or 5 treatments to get the same results, is that people were able to heal much faster because there was no mental bias around this. And that really gave me an appreciation of the power of the mind, that we're not just trying to treat these physical symptoms, but the power of the mind and someone's willingness to heal and their acceptance of the type of modality can make a big, big difference. What also impressed me in my time there is we were fortunate enough to observe a C-section that was done with acupuncture anesthesia. This will not be coming to a hospital near you anytime soon, but it is still traditionally done in China. And it was amazing to really see, you know, the acupuncture needles were inserted. She had about 20 minutes to induce a very strong relaxation response before they came to do the C-section. There was a little curtain, so she couldn't look down, but we were above her in this observatory looking down so we could see everything. And her face was visibly relaxed for the majority of this procedure. So that relaxation response was really maintained for most of the time. It was only at the end when they were starting to stitch her back up that you could see she was starting to grimace a little bit, and she had more sensation now of what was happening there in the abdominal area. And so one of the doctors just brought the baby right next to her head, so that she could be looking at the baby, and then you saw her visibly relax again. But it was a phenomenal experience to see really just the power of this medicine and its versatility and how it is used in its native land in that context still. So in traditional Chinese medicine, or TCM, we say there's 3 levels of medicine. And one of my favorite quotes from the Shen Nong Ben Sao, which is an ancient Chinese treatise, says that the lowest level of medicine is treating the physical body. And so this is all the signs and symptoms that we typically see in our practice. The next level of medicine is treating the mind. And we say this is really about the nourishment of one's inner nature. And the highest level of medicine is treating the spirit. And so at the level of spirit, TCM says we're really working to nourish the client's destiny. And at that highest level of medicine, we align somebody with their destiny. And so this is exactly what I experienced in that first acupuncture treatment. I had that treatment and I just knew right away, this is what I'm supposed to be doing with my career path and with my life. And over the years in practice, I've been able to observe this with so many clients who are out of alignment, but they don't exactly know why. But once they start to connect with this idea of what is my life's purpose, and they align with their destiny, this helps trickle down to the level of the mind and the level of the body. And so if we're not addressing this level of the spirit, the body and mind may always be out of balance. We do also see this concept in other cultures. So in the Vedic culture, we have a term called dharma, which is your life's purpose. So when you are aligned with your dharma, we really say that is the foundation of health. Without that alignment, that you can never achieve true health. There's also a Japanese term that some of you might have heard called ikigai. And so ikigai is the reason to wake up in the morning, your sense of purpose. And the research that's been done in the blue zones, that's been very well documented over the years, has shown that centenarians have this one trait in common, is they all have this ikigai, this sense of purpose and this alignment with their destiny. All right, so I want to just share a little bit of a contrast between the Western and Eastern view of the brain, the mind, our sense of emotions. And so in Western medicine, we really look at the brain as the top of this pyramid, and that there's a very kind of linear cause and effect view of how emotions get triggered through our limbic system, the cascade reaction that occurs in our nervous system. And the TCM view of this is quite different. So we look at not the brain at the top of the pyramid, but we look at the brain and mind as inherently connected, and that anytime you have a disharmony in one, it's always going to create a disharmony in the other, that's inevitable. And a term that we use, a Chinese term called Shen, can be translated as heart, as mind, or as spirit. But actually the understanding of Shen is the combination of all of those things. That Shen is heart, mind, and spirit, and all 3 of those function together as one cohesive entity. So the Shen is much more than just the brain and our cognitive functions. It's also our emotional regulation and our capacity to be creative, our capacity to acquire wisdom. So all of that is contained in this idea of the Shen. So one more concept I want to share here is the concept of innate intelligence. And I often have this conversation with my clients where they can be very impressed with whatever physical healing, mental healing they're experiencing, and they like to equate it to the power of acupuncture, which is a powerful modality, and I don't want to take anything away from it, but I do believe it's the innate intelligence within us that's always doing this healing, and that whatever modality we use, whether it's the acupuncture or anything else, it's really just tapping into that innate intelligence and stimulating it and allowing that healing to occur. So I've seen over the years that the body, the physical body, is actually much more willing to heal, and the mind is the one that's much more resistant and stubborn. So sometimes I've seen physical symptoms can resolve quickly, but once I really understood this concept, when I have a new patient interview and someone's coming in telling me about their chronic pain, maybe they've had migraines for 20 years or low back pain, whatever it might be. And my first question to them is, do you want to let go of this? And it sometimes takes people by surprise, and they say, well, of course I want to get rid of these chronic migraines of 20 years. But the truth is they're kind of used to that pattern. They've learned how to live with whatever that chronic symptomatology is for a long time. And so just being able to pose that question to the client, it's really to get them to understand that they can participate in this process. It is their choice, their intention to want to be part of that process, to want to heal, to want to let go. That's critical to then start the healing process. All right, so that's just kind of a little background about the relaxation response and a little overview of acupuncture. So now to kind of talk about the mechanism of acupuncture specifically, I want to share from the Eastern perspective quickly, just this concept of qi and acupuncture. So we look at qi as that vital energy that's present in all living things. We say it regulates our physical health, mental, emotional health, spiritual health. It really creates balance on every level. From the diagram, you can see in this meridian man, we have a number of different meridians. So most of these run from top to bottom and are bilateral, but we say there's about 14 principal meridians. We have about 365 primary acupoints on those meridians. We also have many extra points not on those main meridian pathways and extra meridians in addition to those 14 as well. But if we look at an acupuncture point, specifically the anatomy of an acupuncture point, we say this is where our qi is the most concentrated, the most abundant, the most vital. And by inserting needles into these acupuncture points, we start to access and regulate that energy. We also have research in the Western world that has shown acupoints are areas of low skin resistance, rich in blood and nerve supply, and a lot more theories from the Western perspective of how acupuncture works. So we don't really have one mechanism to explain this. We have a bunch of different theories, but the overlap of all these theories together really starts to give us an appreciation of how acupuncture is working on multiple levels. So I think the most important theory here is our effect on influence on the nervous system. So we talked about the relaxation response being counteractive to that fight or flight response. And acupuncture does that exactly here by influencing the parasympathetic nervous system, reducing heart rate, blood pressure, as we mentioned before, reducing muscle tension. We also know acupuncture can affect parts of our central nervous system, influencing sensation, involuntary body functions, immune reactions, regulating blood flow, body temperature. There's also lots of research that's been done to show changes in our brain chemistry. So we've documented that when we do acupuncture, there's a whole cascade hormonal reactions that are happening with noradrenaline, norepinephrine, endorphins and enkephalins that we know enhance our mood and relieve pain. So all of these things have been shown to once again trigger that relaxation response, and we can see that happening on many levels. Cortisol levels also can decrease, and we know that stress is that baseline symptom that exacerbates every other physical and mental symptom that we have. So just by being able to decrease stress, we can help with healing all the rest of our chronic complaints as well. Acupuncture can help with the regulation of neurotransmitters, secreting serotonin, which is my favorite neurotransmitter, also dopamine, GABA, and helping with mood regulation, relaxation. We're going to talk about its influence on modulating brainwave activity and what some of the EEG studies have shown. So we'll talk about that in just a few moments. And then the last theory here is about the local effect of improving blood flow, oxygenation of the tissues, cycling out cortisol, other waste chemicals. Just having that physical relaxation is something that can be quite profound for clients who've had a lot of chronic pain. They're used to having tension, and being able to see that kind of immediate relief is something that's quite powerful in the moment. I've also had Parkinson's clients who are used to having really frequent chronic tremors, and some of them come and do acupuncture, and it's the first time they get to experience what it's like to be tremor-free. I've actually seen from the moment I put the needle in, the tremors stop, and the moment I take all the needles out, the tremors start. And so it's quite fascinating to see, you know, just that temporary relief that they can get in that moment, and as they're responding better, that effect will last longer after the treatments as well. So I want to share a slide from one of my teachers who's designed a system called Neuropuncture and does training for acupuncturists. And I love this slide because he talks about just the local reaction from needling. And there's a diagram here of a nickel. So if you look where the needle is inserted and that area around the size of this nickel, you'll see that we have an increase in nerve growth factor, vasodilator release, increasing white blood cells and red blood cells, histamine release, glutamate, serotonin, prostaglandins, triggering this local anti-inflammatory response wherever the needles are. And so this is just a really lovely way to see how we can influence the body locally, and not just the whole nervous system or, you know, change across the body. But especially when we're treating pain, pain is focused in a certain area, having this local effect goes a long way with showing how we're speeding up the healing process. There's also a lot of studies that have been done to show acupuncture and cognitive function. So we've shown that acupuncture can improve memory, clarity, concentration. So this is excellent for students who want to boost their brain power, or if they have test-taking anxiety, this is something they can do pre-taking their test to be able to help with that. We got to experiment on ourselves in acupuncture school. So before every acupuncture exam, we were needling the points that we knew would boost our brain power, and I think they worked. Acupuncture has also been shown to help with brain fog. So especially with long COVID symptoms, you know, over the past couple of years, we've been able to see how people suffering from that can definitely get relief through the acupuncture. With Alzheimer's in the early stages, we do have research that's shown acupuncture can help with that, but as the disease progresses, it's harder with acupuncture itself to really create much change. There's been a lot of research that's been done with meditation and meditation's ability to lengthen our telomeres, which helps slow down cellular aging. But there's actually research that also shows that acupuncture can do this as well. So it can have an anti-aging effect and can be quite powerful with that. And I wanted to share an example of ADHD, since this is a diagnosis that is really starting to grow. It feels like many people are self-diagnosing themselves with ADHD, but this is just becoming very prevalent for people of all ages. Acupuncture can definitely help in this case with improving concentration, focus, memory, helping to manage our mood. minimizing any type of disruptive behavior or fidgeting or hyperactivity. So when I first started treating this, was back when I was still a student in acupuncture school, working in our student clinic. And I was just starting to see a lot of like 7, 8, 9-year-olds coming in with ADHD symptoms, and seeing that the results with acupuncture were actually quite impressive. With just a few treatments, I was getting good feedback from patients, from parents, from teachers in the classroom, noticing an effect. And so if we have the potential to keep our kids from getting on heavy duty medication at such a young age and just trying acupuncture to see what is their response, I think it's worth it instead of trying to get on the medications as our first option. All right, so that kind of sets us up now to go into this idea of what is the influence of acupuncture specifically on brain waves, now that we understand some of the mechanisms, some of the cognitive benefits that we might experience. And so for anyone who might be kind of new to this idea of brain waves, I have just a little chart here to give you a sense of some of the different types of waves, how we measure them in these electrical impulses in these hertz, what are the typical characteristics, what are the activities that are associated with these different brainwave patterns, and what time of day, you know, we might experience this when we're awake or when we're asleep. So I'm going to come back to this in a moment to more specifically talk about which waves acupuncture is influencing the most. So as we look at how are we measuring this, we have EEG studies, we have fMRI studies, and they've been able to show that acupuncture is modulating our brain's electrical and biochemical responses, which is starting to change those brain waves. We're modulating the neurotransmitter levels, serotonin, dopamine, which we've already talked about is going to start to affect our mood. It is influencing brainwave patterns from a neurological, neurochemical pathway perspective. And what I think is really interesting, I'm going to share with you some studies on specific acupoints in a moment, but they've shown that stimulating specific acupoints starts to change our brainwave response. But the duration of the stimulation, the individual energetics of those points can make a big difference at what brainwave change we're starting to notice. Yin Tong, for example, is a powerful point right on the forehead, the midpoint between the eyebrows. This is a point acupuncturists use often to regulate emotions, reduce stress and anxiety, improve memory, focus, concentration. And this point in particular, it makes sense that it would be able to significantly change our brainwave response. So we can also look at the effect of acupuncture on brain activity in a couple different ways here. One is to look at brainwave frequency. So there's points such as Bai Hui, Do 20, which is at the vertex at the very top of the head. Nei Guan, you're welcome to feel these points on yourselves as I'm talking about them. Pericardium 6 or Nei Guan is located here right below the medial wrist. It's about 2 fingers down from the medial wrist. And this is typically where anyone who's wearing one of those motion sickness bands, whoever invented it, I think, did acupuncture and discovered this. But this point is specifically between those tendons of palmaris longus, flexor carpi radialis. And if you press on that point, you might start to feel a little bit of that relaxation response. Using the motion sickness band there gives continuous pressure to the point. And the third point I want to show you guys is large intestine 4. So if you come right between your thumb and your index finger, there's a little depression right here where you can feel that point. So all 3 of these points have been shown to increase alpha waves and the frequency of those alpha waves that thereby help with relaxation and mood modification. We've also seen that acupuncture can influence our brain networks with emotion, cognition, sensation. Another point I want to mention, large intestine 11. So if you guys feel, if you come to kind of your elbow, outer elbow crease, and the lateral epicondyle. And if you try to find that midpoint, there's a little depression in your elbow right here, which is Coochie or large intestine 11. And so this point also was shown in research to decrease alpha frequency in the left and right temporal lobes, the left parietal lobe, the left frontal lobe. So it's interesting to see not just the brainwave pattern changing, but what area of the brain are specific acupoints triggering or influencing. We also see with brain region activity, acupuncture can produce changes in cortical activity of the frontal lobe, the cerebellum, middle temporal gyrus, and other lobes as well. We know there's an influence on the limbic system and subcortical structures, influencing our amygdala, our hippocampus, and the hemodynamic response as well. So there's lots of different ways that we can start to map this out. We don't have acupuncture research that's been done in all of these different areas. So there's a lot of areas to potentially go deeper with and exploring. So here I want to share with you the specific brain waves that acupuncture is targeting and that we're seeing changes with. So the beta brainwave state, which we're experiencing through most of the day with our thinking mind, our concentrating mind, this creates a lot of activity for us. And when we're experiencing this, it can also lead to mental restlessness and overthinking and kind of being stuck in our head, not being able to kind of fight the stress, the anxiety that comes from whatever thoughts our thinking brain is producing. And what I've seen with acupuncture is really within about 5 minutes of needle insertion, people start to experience that relaxation response. It only grows deeper the longer the needles are in. And a lot of people experience this dramatic shift out of that beta brainwave state within that 5-minute time period. So that can be really significant, especially for someone who doesn't have modalities that they're using, they're not meditating, they don't know how to relax. For them to be able to experience that can be quite profound. So the research has shown acupuncture does help increase alpha waves and theta waves. And so with our alpha waves in particular, this is when we're dropping into a state of feeling more calm, more focused, more clarity. We've been able to see this happens in the frontal lobes, the occipital lobes in particular, but this is where we're experiencing that increased serotonin, that mood regulation, and that state of calm isn't just during the acupuncture treatment itself, but that can last longer after that treatment as well. And then the theta wave state, so I would say compared to the alpha and theta, 100% most people drop into that alpha brainwave state during the acupuncture and experiencing the relaxation response. Some patients I feel do go deeper into this theta brainwave state where they will describe it as kind of like a in between waking and sleeping, kind of a dreamlike state. They might have visions at this time. It can unlock creativity. It can unlock inspiration. And a lot of times people will describe it as this feeling of oneness that they're experiencing during that time. So these are kind of the feelings that we should be experiencing with a deep meditation practice. But for most people, if they're not experienced yet, that might feel like a difficult to attain state. Acupuncture allows us to access that state passively without us having to put any effort into going into that deep meditative state. So some of the research I want to share with you, this study on anger I found really interesting. And so in this study, they specifically were doing 2 points, gallbladder 20, which is located on the back of the head near the occipital area, and gallbladder 21, which is located at the very top of the shoulders. So they chose these 2 points for their study, a patient population of about 34 patients, and they did their needle retention for about 10 minutes. And the EEGs were able to show that it did increase anger that was stimulated in these patients, and that they were able to effectively alleviate that entire emotion within that 10 minutes of the needle insertion. So that was interesting to see a very specific emotion, 2 specific acupuncture points that were chosen, and that they were able to measure that result. So I have another study here where they were looking at really just that alpha brainwave activity, and that they were able to show this with acupuncture affecting the parietal and the occipital lobe regions, and measuring that with an EEG. And then I have a couple studies I want to share with you on specific acupuncture points. So I really like these studies that concentrate and bring it down to one point to measure that point's efficacy with measuring or changing the brain waves. So in this group, they had about 16 patients in the study that they were looking at, seeing that the beta brainwave state was significantly reduced as they did acupuncture. A large intestine 11, remember again, is this point here by the elbow that you can feel in that little depression. And it's in the traditional energetics of this point. It's a very powerful point for boosting the immune system. I pretty much always use this point with any of my patients who are cancer patients who are going through chemo. This is one of the #1 points that we will use to boost up their immune system in a really powerful way. And they were also able to show with this point that it influenced delta, theta, and alpha waves. They were able to see this in the parietal, occipital, and central lobe area for the delta waves. And then they were able to see it in the temporal, frontal, parietal, and occipital lobes for the alpha and theta waves. So that was quite fascinating to see that difference. And so the next point I want to share with you guys is Zusan Li, or stomach 36. So this is a point right below the knee. And this is one of the most powerful acupuncture points on the body. Can treat, this is like a miracle point that we say can treat pretty much everything. It's great for emotional regulation. It's great for digestion, enhancing sleep, boosting our immune system, great for treating pain. So this is a wonderful point that they studied here with a population of about 9 patients in this study. And they specifically just did this point on the right side instead of bilaterally. And they did manipulation of the acupuncture needle periodically during this time period as part of their study design. So they showed that acupuncture at this point, using the EEG, was able to synchronize the delta waves and really help with the functional interconnectivity of the brain. And then the last point I want to share is Heart 7. And so this study was looking at Heart 7 and how it influences theta and alpha wave coherence. And I want you guys to just feel this point on yourselves if you come to, once again, this wrist crease. And you're just kind of feeling this is just lateral from that midpoint, but you can kind of feel the point right in here. It's a tricky point to needle sometimes. It can be sensitive, but extremely powerful. I've had patients who are manic depressive. They're more in that mania state. And as soon as they put the needle into this point, they drop out of mania instantaneously in that first minute, which is quite fascinating to see. So in this study, they were specifically just working on this Heart 7 point. They retained needles for about 15 minutes. They had 9 patients in this study. And so they were able to see this coherence with the theta waves in the temporal region, in the occipital region. With the alpha waves, they were able to see this coherence in the left temporal area in particular. And so they really showed how both the alpha and theta waves, with using just this one acupuncture point, they were able to measure that change significantly in just 15 minutes. So it's really lovely to see how some of these studies have focused on individual points. And we spend a lot of time in acupuncture school learning the energetics of close to 400 points, each one having their own way that they function. So it'd be amazing one day, the same way we've like mapped out our genetic code, right? And scientists thought this could never be done, and we've done it. But it'd be lovely to look at the acupuncture points in the body and really be able to map out with each one which brain waves are being stimulated and what effects are we noticing, and how much of that correlates with the traditional understanding that we're taught in acupuncture schools with the energetics of these points. So in terms of future research, I think it's really important for us to look at not only are patients experiencing the relaxation response and seeing a difference with the alpha and theta waves, but if we can start to see which specific acupuncture points and which specific acupuncture point combinations are creating that, I think that would become really powerful and educational for acupuncturists to be able to use that in our protocols as well. We've also been able to document in the research the effect during the time of the needle stimulation, but it would be really nice to see how long can we try to measure the after effect of that post-treatment, that those results of relaxation are lasting. So what I typically see is for a new patient, if they respond well, they might experience that relaxation response in that very first treatment, but the results might not last very long. Maybe they're coming in with anxiety, for example, and they might feel relaxed for a day, and then the acupuncture effect kind of fades away. As they come back for subsequent treatments, we start to build this cumulative effect. And so with each treatment, that relaxation response is actually deeper during the treatment. They're dropping into it faster, they're experiencing it deeper, and then it's also starting to last longer. But it'd be really nice to have some research where we can document how long does this post-treatment effect last. And then it'd be also exciting to see how can we start to target specific brainwave activity and use specific acupuncture point combinations to ultimately affect different neurological conditions, emotional conditions that maybe are resistant to medication that we're prescribing in this area, and to be able to see those changes. So I've been doing this for a long time, about 25 years in private practice and in different settings. And this is kind of the area of research that's always been the most calling to me, as I've been able to see, this idea of the relaxation response in the acupuncture setting and how profound it can be, how transformational it can be, and really want to see how can we develop this more, so acupuncture also becomes associated with the relaxation response the same way that meditation does, and that we can have research that actually supports this and substantiates it, to understand these connections. So for any of you who are new and haven't been to our campus or been to the Osher Center, I know some of you on Zoom might not be local. This is just a little bit about our information here, our beautiful waiting room, our contact information with our email. If you're on Instagram, following us there, where we share updates of all of our activities and things that we're doing. So we do offer acupuncture here, and hopefully we'll grow our acupuncture team soon to start to include acupuncturists with other specialties to kind of complement the work that I'm doing as well. And then I'd love to just open it up to any questions.